does everything that a cranial nerve can do. It has special motor, it has regular motor, it has special sensory, it has regular sensory, and it does autonomic nervous system function. So when we're dealing with 7, you need to know that it does all these things so that you can interpret how this nerve actually does what it does. We already talked about the supranuclear input to the 7th nerve nucleus, and that is from the contralateral side, and the upper face is innervated bilaterally, and so with a lower motor neuron 7, we have involvement of both the upper and lower face. So let's just start with the nucleus of 7. Its fascicle travels dorsally for a short portion, which makes a bump in the back of the brainstem called the facial colliculus. And then the nerve travels ventrally and has exits at the root exit zone where it's tethered at the pons. Everybody has to go through the ganglion and at geniculate ganglion. And the motor portion exits out stylomastoid foramen. Drops off some hitchhikers to strap muscles in the neck, and in the face it travels to Zanzibar by motor car, which is the temporal branch, the zygomatic branch, the buccal branch, the mandibular, and the cervical branch, controlling the ipsilateral facial muscles on that side. In the internal auditory canal, a small branch, which is the special motor branch, which is the nerve to stapedius. The nerve to stapedius stabilizes the stapes, and if you don't have stabilization in stapes, you might get the symptom of hyperacusis. Sounds might be loud to you. There's also a small sensory hitchhiker that's right behind your ear, which is the regular sensory posterior auricular branch. So right behind your ear, the special sensory goes right behind your ear. So we've covered the special motor, the regular motor, which was to Zanzibar by motor car, the regular sensory, and so now we only have to deal with the autonomic fibers and the special sensory fiber. The autonomic fibers go to the glands. That includes the lacrimal gland and the submandibular and parotid glands. And the lacrimal gland branch starts as a nucleus, travels as nervus intermedius, and then the greater superficial petrosal nerve. And that eventually becomes the Vidian nerve and the lacrimal nerve to the lacrimal gland, which controls tearing. And so a one-eyed dry eye would be a symptom that we might see in a 7th nerve palsy from involvement of the greater superficial petrosal nerve branch, the Vidian nerve. The tongue is carried on chordae tympani. So chordae tympani carries the taste, the special sensory, to the anterior 2/3 of the tongue, and that nerve is called the lingual nerve. The hitchhikers for the autonomics innervate the submandibular glands and the salivary glands, the minor salivary glands, as autonomic branches of 7. So in other words, 7 can do everything a nerve can do. It's got special motor to the nerve to stapedius, regular motor to Zanzibar by motor car to the muscles of the face, as well as dropping off some hitchhikers on the strap muscles in your neck. The special sensory to the anterior 2/3 of the tongue, carried on the lingual nerve via chordae tympani. The regular sensory, which is a hitchhiker after leaving the internal auditory canal just behind the ear to the posterior auricular nerve, and the autonomic function for tearing to the lacrimal gland via Vidian and the greater superficial petrosal nerve, and the salivary glands in your mouth, the submandibular glands and the major and minor salivary glands. So if you just know that every nerve, including 7, has a nucleus, a nerve, and its branches, everyone has to pass through the ganglion, and then you can go to the target organ, I think that you'll see that you'll have a better understanding of 7 by understanding its anatomy.